My name is Morgan, Ph.D. candidate at University of Manitoba. I also work with HDRN Canada as their Inclusion, Diversity, Equity, and Accessibility Fellow, and just would like to express my gratitude for the opportunity to present today on a topic that is I feel very important and very passionate about. So before I begin, I would like to note that I am on Treaty 1 territory. I currently live in Winnipeg, but I have lived across many parts of the province and so have many connections to different treaty areas in Manitoba. I'm a white settler, and I note that the privilege and the access to resources that I have has come from the historical and ongoing colonization of Indigenous peoples who have traditionally been the stewards and caretakers of the land. The work that I'm involved in is not specifically focused on Two-Spirit or Indigenous people, but is really grounded in transforming oppressive structures that do harm Two-Spirit and Indigenous folks. And so in opportunities to align my work with broader efforts toward reconciliation, I try to take those opportunities. Oh. I would also like to note that this project has received funding from the Canadian Institutes from Health Research, and I've also received some funding from the Centre for Healthcare Innovation, as well as lots of support from HDRN Canada in the work that I'm doing. And eventually, I'm going to be presenting a little bit about a project that I'm leading, but want to note that this is not a project that is just me. There are a number of people who are involved in this project who are very much invested in improving how trans and gender diverse people are represented and included in health services research. So very briefly, my hope for today is that by the end of the presentation, folks are going to have a greater understanding of the differences between sex and gender and how that looks in data. I'm also hoping that folks will be able to describe some of the challenges as well as the complexities that are associated with measuring and using sex and gender data in routinely collected data, as well as hopefully be able to think about some particular considerations that they can be doing to address some of those limitations. And so before I start this, the formal aspect, I really like to ground the work in kind of real life. And so the slide that I'm sharing is one that comes from Ray Spoon, who is a Canadian non-binary musician who was diagnosed with stage 3 ovarian cancer. And so this quote was taken from their Medium page, which is a platform that they've used to share a lot about their cancer experiences. And why I think this is such a profound quote is that it's really evident in what Ray is saying that their erasure and their invisibility as being non-binary within the cancer system has really significant negative impacts, not only on their experiences accessing care, but potentially their outcomes. And I think it's important to note that these are experiences that are not just reserved to the cancer system, but also extends to health system more generally. And I think it's also important to underscore here is that while trans and gender diverse people's invisibility is something that is very much a felt and lived experience, um, their invisibility also extends to research. And it's this research that is needed to be able to address the cancer as well as the health system's ability to meet this community's needs. And so the next thing I'm going to talk about are, kind of definitions of sex and gender, and want to note that I am providing a fairly kind of broad overview about these concepts. There's a lot of complexity and nuances with these that I cannot spend, a significant amount of time talking about. But my hope is just to provide kind of a broad understanding around how we can think about operationalizing both sex and gender in our work. So there is a really strong consensus in understanding that gender is a term that we use to describe a person's social and personal identity as a man, as a woman, as something that is between those two, or something that is beyond those identities. It is a word that we use to describe how people express themselves, both to the outside world, and then also how people perceive themselves to be. And we are all from a very early age, socialized to understand and recognize gender in the way that people walk, people talk, and the way they behave. And typically that socialization revolves around how men and women and how we understand them to be different. And through that socialization, we all enact gender day to day through either adhering or challenging norms, as well as the roles we take in our lives and the relationships that we have with others. And it's important to note that an individual's gender expression may or may not confirm with their gender identity. As well, their gender identity may not necessarily correspond to their sex assigned at birth or what's on their legal documentation. And so on the right of the slide are just some common terms that we've heard out in the world to describe somebody's gender. But I definitely want to say this is in no way meant to be an exhaustive list or description of all of the terms that exist to describe the diversity of gender that exists. So the next concept I'd like to talk about is sex. Whereas gender is really about the felt and experienced identity and expressions of who people are, sex is a characteristic that is determined primarily on the basis of primary and secondary sex characteristics like hormones, reproductive organs, as well as physical traits like breasts and facial hair, as well as other biological or physiological attributes like chromosomes and gene expression. We often see sex on legal documents like somebody's passport, their health insurance or provincial health card, driver's license. And while gender and sex are distinct aspects, and I really want to emphasize that sex and gender are different things about somebody, both sex and gender's respective meanings are intertwined. So we experience our gender in ways that is informed by our sex. It either aligns or it doesn't. And sex is typically categorized as female or male, but it's important to note that it is far more complex than this binary that we typically understand it to be. There is significant variation in the attributes that make up one's sex across people. Hormone levels will differ, reproductive organs can and do look different, and they don't all function the same way. And we often think about chromosomes as XX being female and XY being male, but some people have additional chromosomes and they don't always know that that is the case. But their legal sex and the way they understand themselves to be maybe male or female. And I want to raise this as a way to suggest that we often think about sex as kind of this unmutable attribute, and that it means the same thing for everyone, but we can't just assume that it is. There's a lot of variation in these categories, and we don't typically investigate or think about them beyond what we see on the documents. So the majority of the presentation is going to be focusing on trans and gender diverse people. And so I just want to put that out there in terms of who trans and gender diverse folks are. And very broadly, trans and gender diverse people are those whose gender identity and or expression is not aligned with their sex assigned at birth. So everybody, mostly everybody, when they come into this world, are assigned a sex at birth based on the presence of particular anatomy. For some folks, that aligns. We call those people cisgender. And for people who it does not align with, terms that we might be using is trans and gender diverse. And so I use trans and gender diverse, but I recognize that there is a significant amount of variation in the terms that other people may use. So this is the term that I use. You'll see this in some of the literature, but you might see something different to refer to the same population. You may see trans, you may see gender diverse, you may see something else. But this is the term that I like to use to kind of describe the diversity of identities that exist. And it's important to note that trans and gender diverse people may undergo some type of transition. So there might be a social transition where they change their names or pronouns. They may undergo some type of medical transition where they take hormone replacement therapy or they have surgery, but that is not the quintessential experience of being trans or gender diverse. It's really just that felt experience of having their sex assigned at birth not align with who they know themselves to be. And as I've kind of described, trans and gender diverse people, I use it as an umbrella term to describe many identities. The number of gender diverse and trans people who exist, we're starting to learn more about who they are and the words that they use to describe themselves. And so I just use this as a helpful way to describe just the breadth of identities that exist. And the last point on the slide is really just some common terms that you might see or come across to describe this population. But again, in no way is it meant to be exhaustive. So I want to spend a little bit of time talking about trans and gender diverse folks in Canada. As of 2021, with the most recent census in Canada, we learned that 0.33% of the population in Canada reported being trans or non-binary. And I think it's important to note that this was the first time any country had reported on this particular population. And there are some important kind of, I think, characteristics about trans and gender diverse folks in the country. The first is that they are younger than cisgender population. So about 2/3 of trans and non-binary people were under the age of 35. And I think that's really important to note in terms of thinking about youth and shifting demographics and recognizing that this number of trans and gender diverse people, I would anticipate to increase over time in thinking about the age of who folks are. I also want to note that when we're talking about non-binary in relation to what Statistics Canada has released, non-binary is a term that represents multiple identities. And so I'll spend a little bit of time talking about how this came about, but for now, I think it's helpful just to note that non-binary was kind of a category that was used to capture people who did not identify as a transgender man or woman. So let's spend some time talking about how gender is captured. So the first thing I'm going to talk about, surprise, is the Canadian census. So this was the question that was introduced for the 2021 Canadian census. And so you'll note that when we're looking at this, the approach that they used to categorize transgender and non-binary people was first to ask people what their sex assigned at birth was. And this was followed by a question asking people to specify their current gender. People whose sex differed from their gender were classified as transgender. All people who specified that this person's to all people who specified their gender or who did not report male or female um, related to their gender were classified as non-binary. And this is despite Statistics Canada noting that many people wrote in or provided different terms to describe their gender identity. And I'd also like to note that the way question number 3, or the gender question, is framed is categorized using sex-related terminology. So again, we're kind of reinforcing like this idea of male or female, and is problematic because it reinforces kind of this understanding that sex and gender can be the same thing and they can be used interchangeably. And so I think what's important to note also too is that in 2021, based on further engagement and consultation with public and experts, Stats Canada updated its gender standards. And so this included modifying the categories so that it was more consistent with terminology that's used to describe gender. And it's my understanding that the standard has been or will be implemented in most of Stats Canada's programs. So another way that sex and gender data is captured is through electronic health records. And there's been a lot of literature, there's a lot of information out there about why electronic health records or electronic medical records are not necessarily good sources for collecting gender data. So the screenshot on the slide here is one of a mock patient. This is not a real patient. You will note that I have put a red box around the sex field. And so I'd like to point out a few things about this. First is that there is no gender category. There are many different electronic health or electronic medical record systems out there. And so it is possible that some may have a gender category, but it's very common in those situations for the values of that field to mirror the values that are in the sex field. And so again, when we start having a gender field, but the values that are associated with that gender field kind of reinforce sex or are speaking about sex specific terminology, it further supports the idea that sex and gender can be the same thing and they can be used interchangeably. And in doing so, really serves to make trans and gender diverse people's experiences invisible. And I'd also like to point out that one of the options on the drop down includes transsexual. And note that this is a term that has a very complicated history among trans and gender diverse folks, and not one that represents necessarily the majority of the community's identity. You know, this term can be problematic and is potentially inappropriate or harmful, but is present in many of the electronic health systems that are electronic health record systems that are available in Canada. I would also like to highlight how sex and gender are included in registries and surveillance systems. And I note that that is a really broad category, and there can be very different ways that data comes to exist within these registries or these systems. So I'm going to talk a little bit about the Canadian Cancer Registry, which is one that I'm more familiar with. And the Canadian Cancer Registry is a population-based registry that collects information about all new cancers in Canada. Data that comes into the Canadian Cancer Registry comes through provincial and territorial registries. So all of the information that is collected in the province then kind of filters up into the Canadian Cancer Registry. What this means is that information that goes into the Canadian Cancer Registry needs to be accurately recorded in the province or the territory. But most provinces or territories do not have inclusive measures. the North American Association of Central Cancer Registries, which is the organization that oversees data standards for these registries, do not have a gender field, but instead have a sex field. In another example, the Canadian Chronic Disease Surveillance System, which is a Canadian program that tracks chronic conditions in Canada, relies on linked administrative data from the provinces and territories. So again, here we're relying on the quality of the data from each of the provinces or territories to determine the incidence and prevalence of certain chronic conditions. But as I'm emphasizing here, these data do not typically accurately record gender. And if it does, again, we're getting into that field where they're using sex-specific terminology. And so we are unable to report meaningfully about trans and gender diverse folks within this data. And the final point I'd like to mention is related to data standards and outline that there is a lack of consensus for how sex and gender should be captured in data. The image on the slide is of CIHI's recommendation for how to report on data for gender. You'll note that the terms also use sex-related terminology. But one of the things that I really appreciated about this was that they were really transparent about their rationale for making this choice, which was to facilitate easier ways of determining whether someone's sex at birth aligns with their gender or not. And so, this was a really brief and definitely incomplete review of data sources that exist. But despite that, I still think there's some important things that we can kind of surmise about the existing environment for capturing and using gender and sex data. So the first thing I'd like to point out is that there is a lack of standard approaches for categorizing gender across data systems. I do want to note, though, that many organizations are now starting to recognize the significance of accurately measuring gender or collecting information on both sex and gender data, and are working to develop standardized approaches to addressing this limitation. So one of the groups that I'm somewhat loosely involved with is through Canada Health Infoway, which is a sex and gender working group. And that works with folks across Canada who ultimately are looking to develop pan-Canadian data standards for sex, gender, and sexual orientation. And alongside this, as I have noted, or at least I think alluded to, there is a lack of inclusive measures that accurately categorizes trans and gender diverse folks. I do want to note that the two-step method of asking first about sex and then about gender is generally considered the best way for asking people about their sex and gender, but the values that are available are fairly restrictive and do not allow for identifying the many different identities that exist within this community. And then the final limitation I'd like to touch on is that we have a lack of appropriate infrastructure for capturing sex and gender data. And this is very much connected to the fields and values that are available in the system that they go in. And I am aware that some organizations have more control over what fields or what processes they use for putting information in. But this doesn't always flow very well into the databases or data sets that are used for research. So an example I'm familiar with is that some organizations may not necessarily have a specific gender field, but they will create specific processes specific to that institution that allow them to capture information about their patient's gender identity that can then be used by healthcare teams to be better equipped to provide respectful and safe care. But that information doesn't typically go into a database or registry because it's often put in a clinical note, which then needs to be mined and extracted. And so I think for organizations that do have this ability to create specific processes, that's super great. But it also raises a point that we need vendors and people that who are involved in designing these applications to be able to create infrastructure that is capable of including fields and values that accurately describes patients and populations. And so what are the implications of these limitations? I think probably the biggest one is the lack of inclusive and standardized approaches, measures, and infrastructure inevitably results in lower quality data. It negatively impacts our ability to do robust research on trans and gender diverse folks. And it also means that research related to trans and gender diverse folks may represent a narrow segment of the community because they're necessarily going to rely on sampling approaches that use more accessible people, such as those at single sites, particularly those who may be uh, accessing care at a specialized gender clinic, which may not necessarily be representative of the broader trans and gender diverse community. The lack of high quality data and research significantly limits our capacity both to identify gaps and inequities that trans and gender diverse folks face in the health system, but it also limits our capacity to develop evidence informed approaches for addressing those gaps and inequities. And it is noteworthy to mention that research that has looked at healthcare or health experiences, health outcomes among trans and gender diverse folk routinely observe that this is a population that experiences health disparities and differences that are linked to oppression and discrimination, but the extent to which we know this happens or potentially identifying points where we can interrupt that oppression or discrimination are not well known due to the lack of data. And it almost goes without saying, but I think it's important to emphasize here that the failure to collect accurate information around gender significantly harms trans and gender diverse folks, not just in terms of their experiences, encounters with the individuals who are collecting information about them, like through misgendering or using incorrect pronouns, but it also extends to the way trans and gender diverse folks are described and represented in research. So that harm can look many ways, but including failing to acknowledge gender identity as distinct from sex or acknowledging gender as an important experience that impacts somebody's health. And it also can support reinforcing specific narratives about who trans and gender diverse folks are. Um, and so, just as not an aside, but, in some additional work, I'm doing a scoping review, and I have noted that within this research, there's a tendency to focus on trans and gender diverse folks who are using hormone replacement therapy, which is not a universal experience for trans and gender diverse folks. So, what makes it so hard to come up with accurate measures of sex and gender? I think the first thing to note is that this issue is very deeply embedded in a system that has not appropriately reflected or acted on the need to adapt, modify, or transform data systems to accurately measure and report on gender or sex related variables and characteristics. And I certainly don't want, me kind of harping on this to discount the work that people have done towards addressing this issue, because there are people who are doing really good, really hard work to try to develop new and inclusive processes. But I think one of the biggest issues with this is that the gender and sex are not straight, simplistic, straightforward characteristics. They are not easy to measure. And I think, like, as I reflect on the 20 or so odd years that I've identified as being part of the 2S LGBTQ plus community. And, even before that, I think it's really important to acknowledge that the terminology and language that we've used to describe this population has changed and grown significantly. And I think it's realistic to expect that to continually evolve over time. And I think related to this is people's understanding of their own gender identity or their expression can change over time. And this fluidity of someone's personal, deeply felt experience makes this goal of measuring or using gender data accurately a bit of a moving target. And, I think related to this is the fluidity and expansiveness of gender really does make it difficult to categorize. It raises a lot of really important and challenging questions, like what is the best way to define and capture this experience in a neat, well-defined box when gender is something that is so subjective, it's so personal, it's not something that lends itself well to fitting in a box. Another question is it appropriate to categorize everyone in a survey who does not report man or woman to the gender question as non-binary, even when not everyone uses non-binary to describe their identity? When we collapse categories as an approach to increase our ends for analyses, it's more than just trying to get a bigger sample size. The effect is that it flattens the diversity of experiences that exist within the category. And I will say, like, these are not easy questions, and not questions that I have the answer for. These are questions that everybody needs to kind of think about and tangle with, and know that whatever decision is made will likely not satisfy everyone. And the last point I'd like to emphasize, and perhaps this is more relevant to electronic health records and registries, is that typically trans and gender diverse folks are giving information about their sex and gender in a clinical setting. And ideally, it is for the purpose of receiving the care that they want and need. It is not for the purpose of research. And it's well established in the literature that trans and gender diverse people may choose to hesitate or not disclose their identity out of fear of discrimination or receiving poor care. And so, in the context of this, when we're talking about how do we measure gender, it's not just about how do we create the categories, how do we create the values. We also have to think about how we can create safe and appropriate processes for collecting that information. Um, and do so in a way that doesn't necessarily focus on research, but also thinking about how does that impact their experiences with care providers. So, what are the next steps as I see it? Well, I think the first thing that we need to do is develop better data systems. Part of this also includes advocating for vendors and application designers to create, adapt, modify their existing systems to incorporate gender as a unique field and use values that can more accurately describe or categorize folks. It also means establishing data standards and best practices for collecting this information. And I really want to underscore the importance that this work needs to be done through engagement with trans and gender diverse folks. These are people who very much recognize and understand the challenges that exist with trying to categorize an identity that inherently resists being categorized. And so we need to listen to this community about how we should be managing this complexity. The second thing that I think we should be prioritizing is increasing folks' understanding who are using routinely collected data's understanding about what exists within the data and what doesn't. If the data is reporting sex, we shouldn't be conflating it with gender, identity, or expression. We also need to be intentional and ask, why are we using this data and what data do I need? Is the question that I'm investigating about biological or physiological processes? If it is, then maybe, depending on the question, the data I should be using is data based on sex. Or is my question more focused on the experience or outcomes that people have? Then maybe it would be better to look at the gender data if it exists. And when gender data doesn't exist, it's important to acknowledge the limitations that exist within the data that you're using. You know, if you wanted to investigate women's experiences rehabbing from some kind of cardiac event, but all you had was sex data, it's important to note that and recognize that the data that you are using may not necessarily be generalizable to all women based on who's included in the data that you're using. And the third thing we need to do is develop better processes for collecting and using sex data. This very much includes increasing our transparency about where people's information is going and how it's going to be used. It also means being transparent about the decisions that we make in our research and who we are including and why. It also means we need to adopt inclusive research processes. You know, I can't think of a good reason why at this point we shouldn't be including people in research that affects their lives. And I think this imperative to collaborate and work with patients, public, and communities is becoming much more understood. And I think as that relates to gender and sex, we do need to do more to include a population that has experienced significant levels of harm because of research and the way that we have historically excluded them from these processes. And so I think I've got a little bit more time. And so I'm going to spend just a few minutes talking about a project that I'm working on that is really focused on trying to really look at this part of it, developing better processes. And so the project that I'm briefly going to talk about is one that is my PhD thesis, and the title is Beyond the Binary: Gender Diversity in Cancer Health Services Research. And the emphasis here is really advancing folks who use routinely collected data to do cancer research's ability to meaningfully integrate trans and gender diverse folks as well as their priorities into this work or into the research that they're doing. And so how we're going to do that, it's a mixed methods, multi-phase, community-based project. And in the first phase, we're really looking at doing an environmental scan, getting an understanding of what data exists in the Canadian data landscape. And it's starting with a research and data infrastructure scan. So this includes a review of provincial and territorial data repositories, like those held at Manitoba Centre for Health Policy or Pop Data BC. And we also intend to examine publicly available, routinely collected data that's involved in cancer research. So as an example, CanPath, and our focus here will be looking at data dictionaries and coding schemes. And so we use the results of this environmental scan to develop an interview guide, which we will then implement with key informants in the data world. So we'll be having discussions with folks who are knowledgeable about the data systems and get an understanding of what the current processes are for capturing gender, what are the potential opportunities, and what are the priorities. And then in the second phase, we're going to be doing a needs assessment. And this is really the bulk of my own work. And so in the first part of it, we'll be doing a survey with the Cancer Health Services researchers, trying to get an understanding of the barriers that they encounter to including gender and gender diversity. What is their knowledge about the concepts? And what are their priorities that need to be addressed? And we'll use those results to inform focus groups with trans and gender diverse folks who are really going to be involved in, these are the issues. these are how trans and gender diverse folks say we need to respond to those questions and those issues. And then finally, in the third phase, what we'll be doing is we'll be bringing these two phases together with the goal of developing some tools around best practices for bringing trans and gender diverse folks into cancer research. And one of the things that I think is really important about this work is it is very much embedded in community. We have a very, well, very large. We have 11 community advisors who are providing feedback on this project through all different phases. They're going to be helping with the data collection tools. They're going to be helping with, to some extent, analyzing results and really helping us figure out what are the priorities and the results that we need to share. What do we need to say about this project? What are the most important things? And I think we've had a few meetings now, and one of the things that they've done a really good job of just grounding this project in is realizing that this work, while it's focused on research, is really about trans and gender diverse folks' lives. And we need to be thinking about that, not just from the research aspect, but also thinking about how do we make the processes by which trans and gender diverse data is collected safer and better. And that means alongside of data for research, we're thinking about this from points of care and those interactions where people are sharing very personal and sometimes potentially risky information to share. So in summary, what I like to say, the current approaches for measuring sex and gender data are inadequate. As I've illustrated, gender is a complex concept to measure. And when we are thinking about which data we are using for our research, it needs to be informed, and we need to understand what data exists, and we need to understand what data does not exist and acknowledge those limitations in our work. It is very important that in this work we make the strongest efforts possible to avoid conflating sex and gender. Those are distinct aspects about somebody, and they speak to two different experiences of an individual. And in terms of thinking about how we need to move forward, we need to be putting efforts towards advocating for better systems and at engaging trans and gender diverse folks in this work. And so with that, I would like to say thank you for your time and attention. And again, my gratitude for HDRN for giving me the opportunity to be here.